We're going to talk about the pelvic floor in more detail and help you to become aware of it if you're not quite sure where it is or how it feels. So your pelvic floor is a group of muscles that supports your pelvis, and it comes under a lot of pressure during pregnancy due to the extra weight, the load, and everything sort of bearing down towards that region. Now, one of the most common exercises to help with pelvic floor is called Kegels, and these are okay. They're not a horrible exercise, but they don't always train the pelvic floor as a whole, or they sort of train the pelvic floor in isolation. What we really want to do is train the pelvic floor as a whole, including the breath, and we'll come to that a little bit later. So I want you to think of your pelvic floor a bit like a sling. So the sling starts at your pubic bone on the front of your body, and it comes underneath and right to your back passage. So pubic bone to back passage, everything, the muscles coming through there like a sling. So if you think of it like that, and now a little exercise that we're going to do just to become more aware of the different regions of your pelvic floor. If you're comfortable doing so at the moment, close your eyes, and I want you to just focus on your breathing. So take a few nice, really slow breaths. Inhale through the nose and exhale slowly through the mouth. When we exhale, imagine that you're gently blowing through a straw like this. And that should help you to really set your breathing up and get a nice rhythm for your breath going on. So a couple of breaths just as you are now. Inhale through the nose, exhale gently through a straw, and hopefully you'll start to feel yourself, your nervous system just feeling a little bit more relaxed. So with your eyes closed still and continuing to breathe in this way, I just want you to become aware of your left hand. So wherever your left hand is, just use your awareness with your eyes closed, with that nice slow breathing. Become aware of your left hand. And then become aware of your right knee. Again, a few more breaths. So what we're trying to do here is become aware of these different body parts that we know where they are, we know what they look like. And where we've got this kind of subconscious awareness that we can access whilst we're relaxed and breathing without actually looking at those body parts. So I want you to become aware of the top of your head. Again, another couple of breaths here. Inhale through the nose. Exhale gently through the mouth. And now I want you to become aware of the space between your sit bones. So your sit bones are two bones around your pelvis that are what you would be sitting on right now if you're sitting down. So just become aware of the space between your sit bones. And then try and have an awareness of your back passage. Take a breath. Keep everything nice and relaxed. Now, take a breath and try and become aware of your vaginal opening. Inhale through the nose, exhale gently through your straw, and then try and become aware of your pubic bone. So your pubic bone sits on the front of your pelvis. So this, all in all, is your pelvic floor. It's your pubic bone right back through that sling to your back passage. And what we want to really try and do is have a nice connection with this area when we are breathing and when we are exercising. So as we inhale, we want the pelvic floor sling to just relax gently. So on the inhale, we want to try and have that awareness of that area and let that area sort of gently relax. If you imagine it like a sling, it starts out straight. When it relaxes, it goes down like this. As you exhale, we're going to gently use the breath through the straw. What we should feel is a little tugging of the pelvic floor on that exhale. So it comes from that relaxed position, comes up and engages and just pulls up slightly. So as we get more connected with our pelvic floor, we might feel this more easily, more kind of without any effort. But for now, if you're new to doing this, then just focus on that relaxing of the pelvic floor in the inhale and just becoming aware of the pelvic floor as you exhale and what that feels like on the exhale versus the inhale. If you need any extra help, let me know. This is not something that we can necessarily connect with and nail in one go, but what we can do is practice this every day. What I generally recommend is trying to get 10 nice, slow, connected breaths with the pelvic floor in the morning, lunchtime and evening. You can do more if you want to, but setting yourself up to succeed is a good idea. So not overdoing it is probably good to start with. Once you have that good connection there, once you've got the rhythm of the breathing and that connection, then you can sit and do it really anytime, at the cinema, at your desk, wherever you are really. You can do it sitting or standing, but just to start with, have that awareness, be patient with yourself, and reach out and ask for help if you need to.